plan. Every Saturday morning, he's the urology man.
Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Sinise. Glad to have everybody with us. Hey, if you're watching us live, great. Glad to have you on board. Be sure to check out our website at uronurse.com to learn more about the show, visit our sponsors, and visit our other great podcasts. Also, you can listen to us in your car by checking out our audio podcast section. And most importantly, this is episode 166. So that means there's 165, soon to be 166 past episodes. So be sure to check all of those out. Also, if you're new to UroNurse News, that comes out every day of the week. And this week we have on Monday, breakthrough devices for overactive bladder. The FDA clears the AltaViva implant. On Tuesday, I'm talking about a shocking study. Cannabis users face 4 times the risk of diabetes. On Wednesday, I'm a doctor, but call me Jenny. Find out why. On Thursday, is biparametric MRI the future of prostate cancer diagnosis? This is an interesting one. It can save a lot of time in that machine. And then finally, on Friday, we'll wrap it up with a Harvard AI model that could revolutionize medicine. PD Graffers explain. So be sure to join us next week, starting on Monday at 9 a.m. Central Time on UroNurse News. You can get that from our regular website. And let's bring Lori back in here too. Hey, Lori, welcome to the show. Oh, there we go. Forgot to add you in.
Everyone.
So, hey, yeah, we got Lori and I were talking a little before the show, and normally a buzzer goes off on my watch with the 1 minute mark, and I'm like gabbing away, and I'm like, holy cow, we need to start. So, if we were a couple of minutes late, that's why we just got gabbing. So today's an interesting show. I had to pre-record it because the speaker was just unavailable to come in on a Saturday morning, but I thought it was a great one to go ahead and do. So I'm going to go bring in his talk right now. Today, we're joined by Kirk Huntsman, a pioneer in healthcare innovation and the co-founder, chairman, and CEO of Vivos Therapeutics. With over 30 years of experience leading companies in dentistry, healthcare, and now sleep medicine, Kirk has made it his mission to tackle one of the most overlooked health challenges of our time, obstructive sleep apnea. Under his leadership, Vivos has developed groundbreaking, non-invasive treatments designed to address the root cause of sleep-disordered breathing. He's here with us to discuss a fascinating and often missed connection between sleep apnea and erectile dysfunction and what it means for men's health, quality of life, and clinical practice. Let's welcome Kirk Huntsman to the show. Kirk, welcome to the show.
Vic, thank you for having me. This is it's an important subject, and I'm really honored to be here.
Yeah, great. Glad to have you on board. I think it'd be fascinating if you kind of go into a little bit about what you're involved in, how you got started in it. Give us a little history of what's going on here, and
Sure.
Then how it has to deal with erectile dysfunction, which is what our urology side is.
Sure. So Vivos Therapeutics came to market primarily as a medical device technology. And our initial go-to-market strategy involved training and educating dentists because our technology is mediated through an oral appliance device. So it requires a dentist to insert and sort of monitor the progress. But sleep apnea is something that, as you know, and as your listeners, if they don't know it, they'll soon learn. Sleep apnea is a pervasive and serious medical condition, and it affects all ages, all demographics. It affects males and females. It affects men more frequently than women, but it's still very pervasive. And it's not just about men who are overweight. This is a condition of anatomy. It's a condition of neurology. It's a condition of sort of just it's a complex condition that has its roots in a number of different things. It actually, in many cases, go back to early childhood and a lack of full development in our jaws, in our oral cavities, in our nasal passages. And so these conditions in our modern context afflict many tens of millions of people in the United States alone, and 1 billion people worldwide. So we're talking about something that really 1 out of every 8 people on planet Earth is suffering from a breathing and sleep disorder such as obstructive sleep apnea. And obstructive sleep apnea, especially in its moderate to severe form, is really where a lot of the damage takes place. And we're here today to discuss the connection of obstructive sleep apnea with erectile dysfunction. I think it would be interesting for your listeners to know that obstructive sleep apnea is comorbid, what's called comorbid. That means it coexists with all forms of chronic disease, such as cardiovascular disease, diabetes, fibromyalgia, mental disorders such as early onset Alzheimer's and dementia, and all types of depression and anxiety, erectile dysfunction. And one of the reasons, there are many reasons for these connections, but anytime that our sleep is disrupted, anytime that that we have hypoxia, which is a decrease in the proper levels of blood oxygenation, we damage especially the endothelial linings of our arteries, our heart, our nasal passages, throughout our entire body. When we disrupt our sleep, we precipitate a cascade of different things that basically manifest as inflammatory, high degrees of inflammation, and a chronic, perpetuating sort of cascade of other events. And so we know, and we're bringing to light every day in the research more and more things that are associated with poor sleep and poor, what we call sleep architecture, how we sleep. And we know that erectile dysfunction is right there front and center at that. So like I said, it's great to be with you today to discuss this. And I think your listeners are going to find some fascinating things, because the overlap between erectile dysfunction and obstructive sleep apnea is not only well documented in the literature now, but it's highly pervasive. So you've got, over 2/3 of patients that have one have the other, and it's bidirectional. So if you have obstructive sleep apnea, your likelihood of having erectile dysfunction is quite high. If you have erectile dysfunction, your likelihood of having obstructive sleep apnea is quite high. So these things tend to go both ways, and it's not exactly clear what the causal factors are, but we know that sleep apnea is a big one.
And a lot of people don't realize they have sleep apnea. I actually wear my watch to sleep just for that reason, because it tracks my sleeping and then has an app that'll tell me whether I've had any incidents of sleep apnea.
Yeah. It might be interesting for your readers to just get a little bit of an understanding of what sleep apnea really is.
Sure.
And sleep apnea is a condition where an apnea is the cessation of breathing, where there's a closure or an obstruction. That's where you get the obstructive sleep apnea. There's an obstruction in the airway. Sometimes it's the tongue that falls back into the throat. Sometimes it's an actual collapse of the pharyngeal wall or the tissues of the airway itself. But there's some sort of collapse or obstruction that's created that lasts at least 10 seconds. And so if you think about your airway collapses, you're asleep, you can't breathe. And this is where a lot of times spouses, bed partners, et cetera, will report that a person with sleep apnea, they'll stop breathing, and then all of a sudden they'll gasp for air, and they'll kind of just shake open. And that type of thing that goes on, every time that happens, it's counted towards something called an apnea-hypopnea index. then the more you go through that cycle, and I've given you sort of an simplified, definition there, but the more you go through that cycle, the more times that happens, the more events you have that count towards your apnea hypopnea index. And if you do that more than 15 times in an hour, then you have moderate sleep apnea. If you do more than 30 times, then you have severe. So you're really talking about just a cessation of breathing where your body is actually sort of unable to bring in oxygen. It's unable to either expire or exhale or inhale. And so you're really stuck. And that constant disruption of sleep disrupts brain waves and brain patterns. It disrupts hormonal processes. It also does something really terrible to our brains that we now know in some of the most recent research. We know that at night, especially during REM sleep, the body flushes all of the toxins that are accumulated throughout the day and through something called the glymphatic system. And the glymphatic system needs to flush those toxins out in order to rejuvenate and restore the brain's capacity and its ability to just function. And so the rejuvenation part of sleep, if that's interrupted by sleep apnea, then people who awake in the morning, they don't feel rested, they don't feel rejuvenated, they don't feel fresh, they don't feel like they're ready to go to take on a new day. And that's where you start to see some of the neurobehavioral problems with children. You start to see, and sleep apnea, by the way, can affect not only adults, but children as young as infants. And usually we see them about age 3, but where mouth breathing starts to occur, and then you start this cycle of things that go on. And so there's plenty of research now that is linking all kinds of health issues. And one of the things that's really important for your listeners, if they take nothing away from today, other than the idea that, a lot of men in particular have jobs where they worry about, if they are diagnosed with sleep apnea, that they're going to have to go into a CPAP. And one of the big, and so they avoid being diagnosed like the plague. Nowadays, there's good.
Wait, I didn't interrupt you a second. Can you explain that?
Yeah.
What type of job would you not be able to have? You'd have to have CPAP.
A lot of times, construction workers, if you're driving heavy equipment, or if you have a commercial driver's license, if you're a pilot, if you are any type of, there's all kinds of different professions where they don't want you falling asleep on the job. They don't want you dozing off with excessive daytime drowsiness, which is a prominent condition of sleep apnea. It's sort of one of those things that goes along with it. And so if you have any type of job that requires you to be alert and to be on point, air traffic controllers, for example, pilots, commercial truck drivers, other people that have to get train engineers. Anytime you're in any type of situation like that, you may be required periodically to get tested for sleep apnea. And a lot of these guys avoid it like the plague because they don't want to wear a CPAP. And what I'm here to tell you guys today is that CPAP is no longer the only option available to you. My company has a particular oral appliance device. I don't know if you want to show them on the screen there.
Yeah, let's go ahead and bring that up.
And we can show them these devices are oral appliance devices. I know they might look a little intimidating. I often joke around, they look like medieval torture devices that might be used, but actually there's no pain involved. You wear these things at night. You don't have to even disclose you're in treatment, because during the daytime, you're not wearing these devices. So These things are worn after dinner at night and until you wake up in the morning. And in about 9 months, we actually remodel a human airway. And I'll show you kind of how that looks here, showing just a little bit. But you can see this is a 30-year-old male. And if you see, this is actually a video that's embedded in a slide deck. We don't have the video capability here, but if you look at the on the left, that colored section that goes kind of behind, that's the human airway. That's right behind the tongue, goes up into the nasal passages and then down sort of below the back of your throat. And that is the human airway. And that human airway, 5 or 6 inches of real estate, which is, this is where these are the pipes that get clogged up with sleep apnea. And you can see how we've redeveloped these with our appliances that I just had on the screen. And this took 14 months. This case today, this was back in 2018. This case today would take about 10 months. And so in a very short period of time, you can actually redevelop your airway. If you're on a CPAP already, you can titrate off of your CPAP in many cases. And so we actually have the ability to do a lot of good things. This is an actual patient who happens to be a doctor down in Orlando, Dr. Tara Griffin. She was her own first patient. You can see how her smile has changed, her facial features have changed, and this is her airway over the course of time. And you can see how it's just bigger, and you get a bigger set of pipes. Bigger set of pipes typically for most people is better. And so this is something that I think is very.
So this, let me just stop you a second with a question. So this is worn through the night, I take it?
It is. It's just, you pop it in after dinner. Let's just say you eat at 6 or 7 o'clock at night. When you finish dinner, you pop it in. We need to get 8 to 10 hours, hopefully, of wear every night or of use. And again, you pop it in, take it out in the morning, go to work, go about your day, do whatever, come back. And it's kind of wash, rinse, repeat. And you do that every night under the direction of a qualified trained dentist and a sleep MD. And you can see, so in this slide right here, where this lady started back in 2011, her this little oval down here at the bottom is that dark oval is her airway. And you can see with just some very minor changes in her upper jaw, her palate, you can see how it jumped. So there was just a 4 millimeter difference of widening of a redevelopment, we call it, of her palate. And yet look at the difference, the disproportionate expansion of her airway, the size of that oval. And then in 2019 it stays. Typically this is one and done. And if you're a heavy guy where your BMI might be a little bit heavy, it still seems to work without weight loss. Many of our patients do happen to lose weight. I'll show you this next patient here, and you can see this woman. Her husband passed away from sleep apnea. Sleep apnea will kill you. Not only will it ruin your sex life, but after it ruins your sex life, it puts you out of your misery, and it'll lop off up to 10 years off your life. But this woman, after she lost her husband, she went in and got tested, found out that she had severe sleep apnea herself. Her AHI score, apnea hypopnea index score, was very, very severe. Within 7 months, it had gone to mild. That's under 15 a night. And then this shows a 2021 picture, but it actually took just another 4 months beyond this one in the middle, another 4 months, and she was at 0. And we took this picture post-COVID, and to show that it lasts. And not only did it last, but once she started sleeping better, her body was able to process the lipids and not excrete as much cortisol, and she ended up losing 50 pounds. And so she ended up being thinner as a result of fixing her sleep apnea. And again, a lot of these things, obesity and OSA, they're linked together, but it's a bidirectional thing. If you want to lose weight, fix your sleep apnea. It's not, if you want to fix your sleep apnea, lose weight. A lot of times it's, you want to lose weight, fix your sleep apnea, let your body rest, relax, and flush the toxins and the fatty acids out of your system. And when you do that, you actually can lose weight. As it specifically pertained, and that's really what I wanted to show here, is that when you're talking about um, the connection between sleep apnea, and obviously these are females, so we don't have that connection with ED, but we do have with men. We're talking about severe severe OSA has an 80% correlation with sleep apnea or with ED. So if you have sleep apnea and you're moderate or severe, it is going to affect your ED. There's just no way around it, because what happens here is that sleep apnea, it has multiple mechanisms of action that all work against us as men with erectile dysfunction. There's hormonal changes where it serves to suppress. When we have obstructive sleep apnea, it suppresses our hormonal secretions of testosterone. So right there, it's a big strike against us. So with lower levels of testosterone, that's a big problem for ED patients. The second thing is that it affects the endothelial linings of our cardiovascular system, which again prevents optimal blood flow. And we know how important that is when we're talking about erectile function. When you have compromised blood flow, then erectile dysfunction becomes more prominent. There are other neurological issues that happen and it could be anything from depression and anxiety and other things which mentally affect men in their ability to sustain erections and to solve this problem or deal with this problem. But it's almost as if you could not conceive of anything that could affect the sexual health and wellness of a man more and attack it on more fronts than obstructive sleep apnea.
All right. I'm looking at these pictures too. You almost can see a change in her face. So this device is causing remodeling of the oral structures. Is that correct?
No, it does. It actually changes. You'll notice how look at how her lower jaw comes forward. So, guys, if you don't have that strong male sort of lower jaw, and you're looking for a more masculine looking, and even if women use our technology all the time to improve and enhance their looks. And if you go back to that slide of that original woman here, you can see this gal had chronic migraine headaches. She had a big, ugly, gummy smile that left her feeling, uncomfortable. She had chronic bronchitis. She had sleep apnea. She snored horribly. It affected her energy levels, and all of that resolved within about 15 months for her. Now, this was back in the early, 2011, 2012 timeframe. And so it took us longer to accomplish that back then. Now it's less than a year, guys. There's no reason why men shouldn't do this. You can stop snoring. You can, or at least diminish your snoring, almost eliminate it in many cases. And we have adjunctive therapies that we do as well, laser treatments and other things that can address specific things like snoring. When I had our laser treatment done, I stopped snoring the next night, right? So it was within 24 hours. My wife said, you didn't snore at all, and no appliance in the mouth. So look, this is a very, very important subject. It's a subject and a topic that every man needs to have. And again, if they don't take anything else away from this today, Vic, other than the idea that they need to go get sleep tested, because you mentioned that you're wearing a watch to kind of help monitor your sleep. There's actual rings that you can wear now, and it's not the Aura ring, which is a great product for what it does, but there are other medical grade rings that will give medical doctors medical grade sleep test results. And you just wear these on your finger. It hooks up to your cell phone, and the next day, and you just go to your own bed. You don't have to go to a sleep lab anymore. You can. In fact, Vivos, our company, Vivos Therapeutics, we actually own sleep centers in certain areas. But so you can go to a sleep center and you can go through what's called a full polysomnogram, or you can just have this done in the comfort and convenience of your own home. And a medical doctor, a specialist, can actually read that sleep test and tell you not only do you have sleep apnea, but can evaluate the quality of your sleep and tell you what kind of sleep apneas you have, what other kinds of conditions you might have with your sleep architecture that may be causing or contributing to your overall health and wellness. And then they can prescribe some type of treatment regimen, which may entail some type of oral appliance therapy, like what we have here at Vivos. Our appliances, the ones that we showed, could you just bring that presentation up? I want to emphasize one thing for these doctors here, or for the your listeners here. Let me just show something here that I think is really important. These devices that they see on the screen, these are the only devices in the world that have an FDA clearance to treat moderate to severe OSA, moderate and severe OSA in adult males. And so every other oral appliance device on the market is only for mild to moderate sleep apnea and snoring. So if you have a mild case, and we have all kinds of appliances. We have other ones but you have to wear those things for life. They don't fix it. These are the ones.
Yeah, that was gonna be my questions. I'm looking at some of these devices. I'm thinking, the rest of my life I'm wearing something to hold my mouth open, basically, as a treatment. Doesn't seem that great.
Right. So what happens today is that most patients get a prescription. 95% of patients who are diagnosed with obstructive sleep apnea, they get a prescription for a CPAP. And while that may be well and good, it's probably not what somebody wants. I mean, this is what I would imagine is a pretty good looking woman that is forced to wear a CPAP. It's not very sexy, and it's not very sexy for guys either, to be in the bedroom with a CPAP device and having to fuss with that thing and wrestle with that thing every night for the rest of your life.
I know a male patient who has diabetes and a CPAP, and because you don't heal as well, the straps were actually causing some sores on his face.
It's all over the place. Millions and millions of these CPAP devices were recalled in the last 5 years by the FDA because they killed over 560 people that are documented cases. And they had 116,000, last time I checked, 116,000 complaints filed with the FDA for those very kinds of issues, creating all kinds of other pneumonias and other things that were really serious conditions. You're not messing around here. And so to manage a disease state for life rather than fixing it, I think most guys would rather say, you know what? I don't want to fuss around with something like this. I certainly don't want to get to a stage where I have to have an implanted device that's going to make my tongue shoot out of my mouth every night for the rest of my life. I mean, there's just, come on, let's fix it. Let's get it back to where it ought to be. Let's make it as good as it can be. We have the tools here at Vivos to do that. These are the only devices in the world who can do that. And I didn't want to make this a commercial for us, but we do have a highly differentiated technology for this. And the main thing that your listeners need to do, and I keep going back to this, guys, get out there and get a test. You have to go to your primary care physician, tell them what your complaints are. If it's nothing more than ED, you ought to get a sleep test. You ought to have a sleep test, and you can do it very easily now. And you don't have to go to a sleep lab. You can, but you can get it done and get the test and figure it out. And once you know, then you can decide how you want to treat it. And if you want to go get a sleep mask and do the whole CPAP thing, then that's fine. If you want to go down a different route, there's lots of options today that have never been available before. CPAP was invented in the early 1980s. It came out of Australia. So we're talking 45 years of the only thing available for most patients. And that's why it's almost automatic that when you have sleep apnea, you get recommended, you get prescribed a CPAP by your doctor.
I think
Many,
it's a good point that you're making about if you're having a problem with erectile dysfunction, looking at all the causes. Now, there's been some really recent literature that came out that said that, people come in to see us all the time and they're having problems with their erections. Of course, they want to try a pill like Viagra or something
right,
to
right,
improve it. And they're saying it's almost could be considered medical malpractice not to do a cardiac workup on them.
exactly.
And then the thought is because, the veins or the arteries that get plaque that go to the heart are much bigger than the arteries that go to the penis. So if you're getting plaque that's actually causing blockage to the penis, it could be even more advanced up at the heart level. And you
No
might
doubt.
find somebody who could have a heart attack because they've
No, that's
got erectile
absolutely true.
dysfunction.
That's absolutely true. And the cardiologists are coming around to the idea that, in fact, my first phone call this morning, dark 30, my first phone call was with a cardiologist out of Chicago he's an electrophysiology cardiologist. He's one of the top guys in the world. But these guys are saying, we have, as cardiologists, obstructive sleep apnea is a cardiovascular condition. And so, and we know that cardiovascular disease is the number one killer. It's not cancer. It's not anything else. It's the number one killer in the world. Guys, we have to address, this has got to be a whole body solution. And you've got to take a look at it. If you're suffering from, if you've had cardiovascular disease, whether it's AFib or, some type of a stroke or some type of hypertension, high levels of hypertensive patients have obstructive sleep apnea, and the connections there are even stronger. If you're having any cardiovascular issue, you need to be tested for obstructive sleep apnea, and you need to know that there are options for your treatment that don't involve a CPAP. If that's why you're avoiding this, then you need to stop, because that's no longer true. And now these oral appliances today, they're safe, they're effective, they work. And there's no reason not to go and get tested to find out where you're at.
Now, since the device, that we've looked at is out there, is it covered by the insurances, or, how expensive is it? If it's not, what's the cost?
It is. Look, the insurance companies, because this is a relatively new technology, the insurance companies are not yet covering it in full, but the insurance companies do cover, typically commercial payers they cover about half the cost, and it's about $8,000 to $10,000 for full treatment in most cases. But most of the insurance companies are covering about half of that. And so what you end up with is a, what amounts to an expensive, orthodontic case, basically, or it's about what it costs to go have ortho. So, but look, what would you pay to be off of your CPAP, or what would you pay to avoid that altogether? What would you pay to have an extra 10 years of life? Yep. I mean, when we treat these patients, it's one and done, right? So you get into this thing, you go through this for a year, 10 months, a year, whatever. And then you put this thing aside, and we don't want you for a patient for life, unless you're having, other issues. But as far as your OSA is concerned, we can address that. And once you address the OSA, a lot of times we find that these other conditions, they dissipate, they go away sometimes. And so it's very, very helpful to get the OSA under control, to get your hypertension under control, to get your other issues, whatever it is, including erectile dysfunction.
And so are there anything we should look for? Are there certain men that you would want to be more careful to screen for sleep apnea? Is there, people who snore, for instance, are they at higher risk? What are some of these risk factors for we need to screen?
Yeah, I think that's great. Great question. So if you are, the easy ones are, if you are overweight, if you are over the age of 40, if you are, if you smoke, if you drink alcohol casually, you don't have to be an alcoholic, but if if you like to have a glass of wine in the evenings, that will increase your chances of obstructive sleep apnea. And so there's some, if you snore, you have a very high degree of a correlation. If you have a neck size that is 17 inches or more, you have a 96% correlation of having sleep apnea. So if you're just wearing, if you're just wearing
16 and a half, I'm good.
yeah, well, see, if you have 17 or more, you have a very high correlation with obstructive sleep apnea. So, there's very simple things to be able to say, yeah, I'm probably at risk. And I've put it off because I didn't want to wear one of those stupid masks. Well, now you have no excuse, guys. No excuse. Go out there and get tested, confirm your diagnosis. And if you don't have it, great. You're one of the lucky few. But when we do testing, we do about 80,000 tests around the country every year. About half of all patients, all men, women, children, about half of all patients have sleep apnea.
Now some of our healthcare workers, and sometimes we have patients watching our show. Can you go a little bit into what's involved with the sleep study to check for sleep apnea?
Well, so the original sleep study was called a polysomnogram, and that's where you typically go to a sleep lab. They have beds there, rooms, and they wire you up and they connect you with all these sensors and wires, and then you're supposed to just go to sleep. And you got people behind a glass wall, they're watching you, right? So they're watching you sleep, which is a little awkward, but a polysomnogram is going to give you the full measure of data that would be necessary to do a very, very comprehensive evaluation of your sleep architecture and everything going on, including brain waves and all kinds of things. When you take it back to the home sleep tests, there are fewer data inputs, but the technology is now advanced to the point where everything that is essential for most people to arrive at a diagnosis of obstructive sleep apnea and the severity of that sleep apnea, it can be done at home. If you have a cell phone, whether it's an iPhone or an Android, it can be done with a ring that goes on your finger or over the tip of your finger, or sometimes there's a wrist unit, a wristwatch type thing. There's different ones that are out there, different form factors, but they all essentially do the same thing. We like one from a company called Sleep Image here in Colorado. It's sleepimage.com. We are vivos.com, by the way, for your listeners. That's kind of how you get a hold of us. And if you just call our help desk, they'll be able to direct you to somebody that can help you either get tested or get into treatment or both. But Sleep Image, we like it. It's simple, it's easy, and it's we like their sleep test because they've developed something called a sleep quality index. Excuse me. The sleep quality index evaluates much more than just did you have sleep apnea with a single metric, right? It takes into account other factors to present a score and a profile that gives the doctor additional insights into the quality of your sleep. Because remember, at the end of the day, it's not just about sleep apnea or as a single measure of your apnea hypopnea index, but there's lots of things that go on with our sleep, and we want to understand that in a comprehensive way. And so sleep tests now, home sleep tests, and the technology behind them have gotten to the point where, there's really a very accurate and comprehensive way to accomplish that in the convenience and comfort of your own home. But you have to get a prescription for that from your doctor to go get that. And if you're going to a clinic for erectile dysfunction to get your meds or whatever, get the doctors there to prescribe a sleep or a sleep test. They can do it. Any physician can prescribe the test. It takes a board certified sleep specialist to interpret the results. So that's kind of where that distinction comes in.
Yeah. Well, there's been a lot of stuff in the literature lately about how important sleep is. And I think we probably kind of breezed by that. It doesn't really matter if I get a full night's sleep or not, but they're showing if you don't get a full night's sleep, and they're calling a full night's sleep 7 hours generally.
Yeah.
If you're not getting that, you're shortening time off of your life.
That's right.
You had mentioned, the what happens is our bodies repair themselves during our sleep. those cortisol levels start to drop, the stress levels. And as you said, these things are affecting our blood vessels and everything else in the body. So it's really important to get that good night's sleep.
Boy, that is so true. And there's, I mean, look, we have ignored the 1/3 of our lives that we spend sleeping. We've ignored that long enough. And now it's time. And now the research and the literature and the medical profession has somewhat begrudgingly, but somewhat late to the party, they begin to acknowledge that, wow, this is really an important aspect of things. The unfortunate aspect of that is that most of the practicing clinicians in our allopathic, medical system today, most of these allopathic physicians did not really get much training in sleep and its disorders and breathing and its disorders. And so, it's an unfortunate, artifact of the education system that they were put through to become physicians, that they don't know enough about sleep apnea. They don't know enough about these disorders, which means go to them to get your sleep test prescription, but then get with a sleep specialist who understands this stuff and can give you some guidance. And that's what I
So if you're doing your own home screenings, for instance, like I said, I wear a watch to check because I thought it's important enough to me from what I've researched, and your watch is telling you, hey, you've got a problem. Is that reliable enough, or do you have to go on and have a formal sleep study then?
No, the sleep tests that you get from some of the more, like, you can't get the data from your watch is not sufficient. It's not accurate enough, and it's not sensitive enough to give the outputs that are required by a physician, a specialist, to render a diagnosis and do that. However, like you said, those watches, the Fitbits, the Whoops, all these different, devices, the Apple Watch, right? All these different devices, they'll point you in the direction so that you should know, okay, wait a minute, there's something not right here. Something's off. I've got to go to the next step. And then you can go and talk to your doctor and say, I need a sleep test. Give me a sleep test.
It's a good screening tool, but not a diagnostic tool. And that's what most of the times what they'll tell you. The Apple say, we don't detect this, or we do detect this, but you need to go and have your physician certify it.
That's exactly right. So,
all right. Well, it's been great. Any final bottom lines? Anything you want us to know that about ED and sleep, or anything else that we didn't cover?
Yeah, I think the bottom line for your listeners is that there is if you want to improve your sex life, if you want to improve your ED condition, improve your sleep, improve your breathing, improve your that part of your life can have as big an impact as anything on your overall health and wellness, and in particular your ED. And so this is not something that, if you think you can just treat your ED with a pill or with some type of medication and ignore your sleep and breathing patterns, you're going to do damage that, or you're going to miss out on an opportunity to really comprehensively evaluate or improve this. And man, I just don't think there's any excuse anymore for guys to not do this. We're always, guys are notorious for being slow to get out and take care of ourselves the way we should. Yeah. There is no excuse for doing that. It's painless. It's affordable. It's out there. If you're out there and you really are struggling with some of this stuff, go get a sleep test.
Absolutely. All right. Well, Kirk, it's been a pleasure to have you on to talk about this. And I think it's important that we get this information out there. As I said, we treat ED all the time, and we've really kind of honed in on the cardiovascular concerns. But, I have to say that sleep apnea wasn't one of the ones I was thinking of, but I will now.
Good. Well, if anybody wants to talk further, it's vivos.com, VIVOS.com. And that could be a starting point on a whole new life. We have this little saying behind me: breathe new life, guys. Come on, let's get after it. Let's breathe properly, not only at night, but in the daytime. Let's open up our airways and open up the rest of our lives to optimal health. So we can do that.
All right. So that was a great presentation by Kirk. If you have any questions, feel free to put those on the questions board, the comment board. Lori and I will do our best to answer those. I did see one come through here. Do you start with your primary doctor or your dentist? And is this covered by insurance? And I think Kirk did a pretty good job of covering that. Any physician, you can go to your primary care doctor and ask for a sleep study, and they can go ahead and prescribe it. And then from there, if it's positive, that's when you have to get into the specialist. And it's the dentists that are doing this Vivos device. So what'd you think about that, Lori?
It was certainly interesting, and I agree that men don't like to go to the doctor, but when you say anything about erectile dysfunction and it might work, boom.
Yeah, that could be the thing that'll get people to think about having something done.
And it's great for women too, because they can get them to stop snoring as well. So
yeah. And I don't know if you've done any sleep studies yourself, but I was mentioning I have the watch, and I wear it to bed at night just for that reason, to track my sleep patterns, to see, after all these literature things I've been reading up for Euronurse News, and they're talking about the value of good sleep. And I have to admit, I was probably not one of the best persons for trying to get to sleep. I always thought it was a waste of time, but changing my mind on that now.
Yeah, I definitely have done the watch thing as well. And so far it looks good for me, but
yeah, mine was okay too. And I suspected, because I don't snore, so that's usually one of the clues. And I didn't know about that neck size, so I made it by a half inch.
Yeah, that was interesting.
Yeah. But my wife does on the other hand, and I told her, I says, why don't you start wearing your watch to bed and check yours out? Because who knows, Of course, my wife's family has such longevity that if she dies early, she'll probably just, keep up with me.
Yeah.
All right. So I don't see any other questions coming through. I do want to bring something up here. So I'm going to talk about next week. We're going to be together over at the SUNA meeting. We're coming live from SUNA. So let me bring up a little advertisement on that.
Join Vic, host of Euronurse, live from the Louisville conference. In this special coverage episode, we bring you the latest updates, insights, and innovations in urologic nursing, from cutting-edge clinical research to practical nursing techniques. Vic walks you through the conference highlights, including workshops, expert panels, and demonstrations. This episode gives you a front row seat to the knowledge and trends shaping urologic care today. Saturday, October 11th at 9 a.m. Central Time.
All right. So join us next week for our show, broadcasting live from Louisville, from the conference center. Lori's going to be there, right?
Yes, I will be there.
So you can meet Lori and I live and in person instead of on the screen. We'll reach out and shake your hand. So I'm looking forward to it. It's Louisville's a nice close one for me. I'm just driving up on a day beforehand, do a little touristy stuff the first day, and then Friday I'm going to go around and see the vendors and give everybody a bird's eye look at what goes on during the conference. So join us to learn more if you couldn't make the conference, but even better if you can make it. Hey, stop by and say hi. All right. Well, I'm never one to be ashamed to stop an episode sooner than later. So unless you have any final comments, Lori, I'm ready to call it a day.
Nope. Looking forward to the conference and hope to see you guys there.
Yeah. What crazy weather we've had. This is October the 4th. And I think it's supposed to go up to 90 today.
Great. Yep. It sure is.
For those of you that have heard my story about I live on a lake and have a boat, that's what I do. And normally by this time of the year, the boat's in the garage already in storage. And I keep going, it's too nice to put the boat away. Mm-hmm. So it's crazy. Last night, my grandkids were over and they wanted to go for their last boat ride of the year. And I said, okay, after dinner, so we're looking out the window. It's like 6 o'clock and it's starting to get dark. I didn't realize that the sun sets at 6:30 now.
Yeah. Yeah.
And we better hightail it out on the boat. So they did get their final boat ride. So
good.
But a few more days and then I guess I'll have to take it out. All right, everybody. We'll see you live coming from Louisville next week for the SUNA special. Bye-bye now.
So here's to the
of dreams.